So here we are again, talking about Chapter 1, Unit 1, in Mosby's Essential Science for Therapeutic Massage. And we'll go back to our screen share to look at the rest of the chapter. The first part, as a review, kind of gave you a lot of language and a few concepts. And it's hard to understand what something is talking about or the meaning behind something if you struggle over the words. So this terminology, building up this level of terminology is very, very important, and it can be overwhelming. And I tell my students all the time to read the glossaries and just kind of go over and over that information. You can, in the electronic version of the textbook, you can make some flashcards. You can label activities that are available for you on Evolve or presented through Canvas. And there's so many anatomy, physiology, pathology resources available. Be careful. Don't get down the YouTube rabbit hole kind of a thing. Don't do that. But look at the high quality YouTube videos that are available to expand the knowledge and hear it again. And also on Evolve for HEC, presented through Canvas, there is a link to many anatomy, physiology, pathology videos that can also have a way of novel repetition on this. So let's watch me try to get back to my screen share, which is always interesting. Ta-da, there we are, I hope. So what is this biological? Biological is the stuff we just talked about. And what is plausible? It makes sense. It's not outlandish. It is based on solid information. And information always changes. So don't, when I rewrite this textbook in 3 to 5 years, there will be things I have to change because things change. It's okay. You have to unlearn as much as you learn. We're making pretty good, solid, educated guesses. And we use the critical thinking model to get to biological plausibility. Now, as far as the other concept with massage, which is mimic normal, even if we don't have comprehensive research, we can justify a statement. If this is this and this is this, and then likely this is also likely to be true. That's where some of the clinical plausibility comes in. We've tried it, it's worked. We've tried it again, it's worked. We can't necessarily capture it in a research design, but there's a history of clinical benefit, and it's not outlandish. It fits within the known sciences. And so this is where we come into how do we apply these things that are a little less concrete, a little bit more ambiguous. How do we apply those in our massage therapy practice? So what we end up with massage therapy is evidence-informed practice. We have some solid research, which would be evidence-based. But we have a lot more layered information, some research, some justified biological plausibility, some clinical experience, subject matter expert agreement, not one, but agreement among many who have experience. Hopefully we'll get to a point where these ideas are tested. with research. We need researchers. Maybe that'll be something you'll do in the future. In the meantime, we have to be very honest and ethical about how we present the benefits of massage. So here's our section objective. And here we are with our subsection and what we're going to specifically drill down on now. So one of the things we have to be careful of is correlation and causation. Two things can happen at the same time, but that doesn't necessarily mean one thing caused the other. So what research tries to do is establish causation. So here's a little example here. Observation: when I wash my car, it rains. Correlation: washing the car in a rainstorm can happen at the same time. But that does not mean causation, that washing the car made it rain. And a lot of times what we see as facts, how we want to process stuff, is correlation, not causation. So we have to be very careful. This is part of ethics and professionalism, about establishing actual cause and effect with what we do. And a lot of people do that. And really it's more about, maybe, I don't know, could be. Just because two things happen at the same time does not mean that one caused the other. So this goes on to explain what this is. And there's criteria here that has been used to research and come up with criteria on how we would measure, is it actually causation. This is called the Bradford-Hill criteria. So when we're thinking about biological plausibility, when we're thinking about evidence, these are the things that we would want to stop as a researcher. We would want to stop and take a look at. And we're all researchers because we're all using a critical thinking process to come up with the best platform for what we are going to do. So in your class, as you're reading through this text, what I suggest you do is look around your environment, your personal environment, and see if you can find some examples of how this might work. And let's see if I can find one here. So here's one here: specificity of association. There must be a one-to-one relationship between cause and outcome. So as I've been doing the series of videos for both of the textbooks, inevitably my parakeets chirp. So we can figure out if that's causation or correlation. Now, I happen to do these in the morning when I'm fresh. And that also seems to be when my parakeets are the most noisy. I also like to open the windows and let fresh air in. And so the parakeets are stimulated by the noises from outside. And I like my parakeet chirping. I like to hear that. And I thought about putting on some headphones so that you didn't hear them chirp. But at the same time, I want this to feel real. I want you to feel like I'm talking right to you. I don't want this to be real, stiff. I want this to feel engaging to you. So if I change my environment too much, then I'm going to start to feel constrained. So hearing the chirping in these videos, I don't know if that's a one-to-one relationship between cause and outcome. I do think the timing is. If I were to do these more in the afternoon when the birds are not so chirpy, chirp and tweet aren't chirping and tweeting, then I might not even think of it as a relationship. But I can't call it correlation. The birds chirping don't make me do these videos, and me doing these videos don't make the birds chirp. So that's an example of how we might want to practice our understanding of these criteria, so that when we get more into research or we start to look at the outcomes, our successes, and things that are less successful as we work with massage therapy, we can start to make more sense of it. So that is our a little overview on evidence and what our current knowledge is about that. And as I go through this textbook and Fundamentals of Therapeutic Massage, we're going to grapple with this when we try to achieve outcomes through massage therapy for our clients, and use good evidence when it's available. And it is better. It's much better. I was able in Fundamentals of Therapeutic Massage to justify the 4 main outcomes, which is well-being, stress management, pain management, and functional mobility. I actually was able to use systematic reviews to inform the value of those 4 outcomes. So it is getting better. And we're not going to understand any of this if we don't understand how the body works, because massage works through the body and the therapeutic relationship of the therapist to the client. So anatomy and physiology is important. And I know that there are people that find this more difficult, but I'm trying to help you get excited about these studies, especially setting the stage in this first chapter of this book. And I think using a book like Essential Sciences that is a little bit more conversational, the information has been pre-sorted. If it's in the book, you should have a working knowledge of it, not memory recall, not that, but you should go, I think I read about that, or I think I heard somebody talk about that. That's why I can understand it in a various research design. Or if a client says, is it possible to work with the fluid that can accumulate in my ankles when I stand all day? Is that even possible? So the research is a little scant on that, but I can mimic normal with that, so I can make a case for that using biological plausibility. So here's your review, what you have learned. Another novel approach to the language and the concepts. Here is your learn more on the web. And here is a summary. And here is our first critical thinking, critical reasoning activity. This is new to this edition. So I wanted to take the time to go over this. So each chapter in the textbook features a critical thinking, clinical reasoning application of the content as it relates to the practice of massage therapy. Recommendations for additional research, questions, that sort of thing are provided. It's important to get familiar with the 2 websites, MEDLINE Plus, which is your information base, and PubMed, which is a research platform. These two are vetted, and you're not going to find information on here that is too far off of what is considered plausible or supported by research. Questions are based on that particular content in the chapter. And then I went through, and Luke, my co-author, we went through and we said, well, now how would I answer that? So our opinion, our informed opinion, is also provided for you, and it's under content updates, and it's at the end of the chapter question answers and rationales. So here's our little scenario. Julian Sanders is a 38-year-old man. He's been receiving massage to manage general aches and pains related to work activities. He just completed his yearly medical exam, and some health concerns were noted. So at 200 pounds, he's 30 pounds overweight, and a blood test showed prediabetes. Prediabetes exists when a person's blood glucose levels are higher than normal, but not high enough for a diagnosis of diabetes. The condition is related to dysfunction of the endocrine system. Treatment consists of losing a modest amount of weight and some lifestyle changes with exercise. And people who have prediabetes have a 50% greater risk of heart disease or stroke and moving into full diabetes. And this is also genetic, and this runs in his family. Now, he also has a sinus infection that he thought was an allergy, and he was prescribed an antibiotic, and then he was also sent for diabetes management education. So there are some complexities within this. And of course, we're trying to see, as Julian's massage therapist, how we are going to alter massage therapy based on this information. So we're probably going to have to learn more about prediabetes and diabetes. And the best place to start with that is MEDLINE Plus. MEDLINE Plus. So as soon as you get done viewing this, you need to get on your browser and open up MEDLINE Plus and thoroughly explore that and all of the resources that are there. It's amazing on what's available, and it runs just fine on a mobile device, and you can use it actually within treatment. If somebody says to you, well, they're going to give me this medication, or they told me I had this, and well, you know, I can look that up. I can look it up right there using my mobile device. There are other sites, there's other things you can do, but learn one first. Learn MEDLINE Plus first, and then you can expand out if you want. You can also search for massage therapy using terms massage, therapeutic massage, and then massage therapy. This you can search on PubMed, which is a database for peer-reviewed research. And so again, as soon as you get done watching this video, I want you to use your browser and look up PubMed. And there's some tutorials there, and it teaches you how to use it. And I've given you some hints on how you can narrow down your search and try to look at research that is within a 5-year range. It may not always be available, but that's going to be your most current. And there's filters on there that you can use to do that. Then these are your discussion points that you would respond to. How does the vocabulary in this chapter help you understand Mr. Sanders, our character up here, physical problems? So we have a general idea of the body systems. We had a little bit of an overview of the endocrine system. I can start to narrow down, you know, kind of where the symptoms are presenting. And I can begin to make sense in my head of what's going on here. How do the various types of anatomy study contribute to your understanding of Mr. Sanders' situation? So a lot of times what you have to do is formulate an intelligent question before you can get good information back. So in the chapter, we talked about developmental anatomy, gross anatomy, regional anatomy, systemic anatomy, surface anatomy. And I would take a look at certainly systemic anatomy here. But when I touch the body, I'm always dealing with the grosser anatomy and the more surface anatomy. So, and I might want developmental anatomy a little bit to get an understanding of a generalized way that this body might be functioning in an aging process. How might the information about Mr. Sanders be categorized in each of the main areas of physiological study? So this is the parts, and this is how the parts work together. So systemic physiology is the study of body systems, and pathophysiology is the study of disease and the functional changes of the body during the course of an illness. Now, we're not teaching you to be medical doctors or diagnosticians specifically, but it would be helpful if you had some information that diabetes and prediabetes has to do with metabolic issues, that it's within the endocrine system, there's a genetic predisposition to this, that there is a relationship between increased fat, increased weight gain, exercise, and predisposition to this. There's also stress that's involved with this. Which of the characteristics of life are most affected by treatment recommendations for Mr. Saunders' prediabetes? So they want him to lose weight. That was the first thing. In addition, probably when he gets into the diabetes management, there's going to be an exercise program, there's going to be some sleep hygiene, there's going to be some stress management. And these are attempting to normalize how the body is functioning. So as we go through these, maintenance of boundary, movement, responsive conductivity, the first one I see that jumps out at me is metabolism, also growth as part of the weight gain, potentially digestion and absorption, what's going on there, and maybe even circulation as we try to figure out how hormones that are involved in diabetes are moved out through the body. And how at various levels of organization is Mr. Sanders' body being affected? Well, all of these. This is beginning at a cellular level. There's something that is then going to be changing in function at an organelle level. The tissue level might show some symptomatic things. Certainly you're going to have changes in the pancreas or an increase in fat distribution. The organ level, where the insulin is produced and the regulation is managed. and then the entire endocrine system itself and how it affects the whole body, because all of these work in conjunction. Consider the benefits of massage for Mr. Sanders. Up to now, he's used massage for general muscle discomfort. However, his diagnosis means indicates he needs to exercise more. And how will that affect these aches and pains? And how are we going to adjust our current outcomes and expectations? And how might the diagnosis of prediabetes alter the massage application? So I have to learn about prediabetes and see if there's something that I have to do with location, pressure, drag, methods I might use in order to help but not harm. So what I've done in this first chapter is actually put the author's response here, right in the chapter, and the rest of them are on the Evolve site, so that you can see the thinking process that I went through with this, and what research I used, and how I was confident in the decision that I made, and how I'm going to adapt to working with Mr. Sanders as his massage therapist. And then the final thing down here, given these facts and studies, it seems reasonable, clinically plausible, to include stress management outcomes in the massage plan for Mr. Sanders. That's over and above the general aches and pains. So his general treatment or care plan would be changed. So the workbook for this chapter is on the Evolve site, and just like we have in our Fundamentals of Therapeutic Massage, we have now multiple choice questions for review and discussion. As you work with these, you want to make sure you understand, you define, you know the meaning of every word in these questions. If you don't, you're not going to be able to figure out the right answer. Factual recall are more definition process questions. So here's one that's fun. The complementary relationship of opposites is described by, this is overarching into some of our cultural overlap. So we're going to have to know what organ and system organization means. We're going to have to know what complementary means. They work together. Responsiveness and metabolism. So our key here is relationship of opposites. So then we've got yin and yang, and we've got correlation and causation. So this is not an opposite. These are characteristics of life. This is how the body is organized. But this is an example of how two come together to form one. Relationship of opposites. So a chemical reaction that occurs in cells to accomplish the transformation, production, or consumption of energy is, so we need to know what that means. And then we've got these characteristics of life here: absorption, digestion, responsiveness, and metabolism. And if you don't know what these are, it's going to be really hard to figure out. The answer is metabolism, but absorption and digestion are part of metabolism. When we get down into the more complex questions, and some content lends itself more to this factual type question, and other lends itself more to the concept identification, or how you're trying to connect the dots in a question to find the right answer. So let's look at a more complex question here. Let's look at this one. How do we use physiology in the application of massage? So as a massage therapist, in order to answer this question, you're going to have to know how massage is applied and how it affects the body, which is the physiology, before we can work our way through the correct answer here. So physiology is how things work, where physiology is about being alive. So location of structures to be manipulated. Well, that's important with massage. We need to know that. But is that makes sense with our key term here of physiology? So structures are the parts. You can have structure when life has ceased. You would have a body, but you don't have physiology at that point. Specific positioning of the client for assessment. So this is something that you do, but it is part of the application of massage, but it's not targeting a challenge to the body, which is going to require something to happen with the physiology. Decision making related to projected outcomes. So this is saying, if I'm trying to achieve a result with a client, I want them to relax, or I want them to sleep better, I have to decide how I'm going to trigger that response using massage therapy. And that is going to entail using massage to affect a function, a physiological function. So this is probably the right answer. And then directional communication in charting. So this would be caudal, cranial, medial, lateral. And while that's really important for us to understand where we're working and describing that, it's not about function. So that's how you would work yourself through one of these questions. When we get to the end of this, you're going to be asked to write your own test questions. This is a great learning, this is going to be a great learning response. And we've started out on chapter 2 here. Get back to our electronic version here. Writing your own test questions and coming up with really good wrong answers. That's a really excellent learning process. And I strongly encourage you to do that and combine those together and do study groups where you're working together, and you can use a platform like Zoom or Microsoft Teams or something to work with your fellow classmates. Through Canvas, there's a discussion board. There's lots of things you can do about that. And here at Health Enrichment Center, we're going to do multiple activities as a way of understanding the textbook. It's my expectation that you've listened to this video, you've used it, or these 2 videos, you've used it to organize your study of this chapter. And so when we are doing something face-to-face like Zoom or in the classroom, then we can really work on understanding application and connection, as opposed to trying to deliver the facts. So you will be able to do that as your own self-teacher if you do all the activities in the textbook, write some test questions, really make use of the Evolve resources, combine this book with Fundamentals of Therapeutic Massage and all of those chapter resources and Evolve resources. Go outside of the platform that we have here. Use YouTube intelligently to have novel repetition. Look at other textbooks, see what they have to say about this. Thibodeau and Patton write a large academic textbook for Elsevier, and it has an excellent online course that goes with it as well. And you're going to, it's expensive, but you could get that. You could get that textbook, or maybe even better, your school has that textbook and access to the online course so that you can augment that information. Kevin Patton is wonderful, and I really recommend his books. He has been instrumental in helping me write this book, and has been generous with a lot of his art, and understands the importance of narrowing the content down for massage therapists specifically. So the next chapter we will work with is chapter 2, which is unique to this book, and talks about mechanisms of health and disease, which is right where massage therapy is situated to best help people. And here we go. We're going to stop sharing. We're going to try to stop sharing. Ta-da! Here we go. And we'll close this out. We'll end this. We will try to end this. And the next one will again be for chapter 2.